to recognize some of our friends in the legislature who've come out here to support all of you today and who have our backs out there. Representative Alonso, are you here? Give a wave. Awesome. Representative Neistat. Senator Ellis. Senator Davis. Woo! Glad to see you back. Senator Lucio. And Representative Vo.
Representative Lucio 3.
Oh, I'm sorry. It was Representative Lucio. I look forward to seeing Senator Lucio too. All right, and it's Jean Wu. I have some very messy handwriting here. So sorry. Thank you. And next we're going to hear from Scott Chase.
Good morning. My name is Scott Chase. I'm a small business owner in Dallas, Texas, and board chair for the Oak Cliff Chamber of Commerce. I know that my 600 fellow business owners in the chamber believe that a healthy and educated residents are necessary for sustained economic development, not only in Oak Cliff, but in the entire state of Texas. The Medicaid expansion that is available to Texas will lead to millions of insured, healthier residents of Texas, and that's a benefit to all Texans. The Oak Cliff Chamber was the first local chamber in Texas to call for the state legislature to expand the Medicaid program. I learned today that the North Dallas Chamber in Dallas has also endorsed Medicaid expansion. So business groups all over the state are coming to the idea that Medicaid expansion is a great idea. Despite that, I'm worried that the legislature will not expand Medicaid. Medicaid expansion makes good sense for three good reasons. It's good for businesses in Texas. Accepting the funds would mean critical money for Texas hospital and physicians that are currently not being paid for the care of the uninsured. Additionally, accepting the funds would allow these medical providers to stop recouping part of their loss by charging more for insured patients. This extra charge shows up in the premiums that business pay for their group health insurance. But having Medicaid insured patients will reduce the growth of premium costs for group plans all across Texas. It is good for residents of Texas. Accepting the funds would mean that patients insured by Medicare would get preventive and other basic health care they do not now get. That means a healthier Texas, and when workers are healthier, that's good for business too. It's good for local governments and taxpayers. Accepting Medicaid funds will enable public hospitals like the one in Dallas to recoup costs that are currently not getting for uninsured care that is paid for all of us in the form of higher local property taxes. When a state government program like Medicaid expansion is good for taxpayers, local government, business, and most importantly, us as taxpayers, that means it is good public policy. Good public policy ought to be the goal of good government. The Oak Cliff Chamber also believes in personal responsibility and would support copay or premium requirements for personal accountability, modifications to the existing Medicaid program for long-term sustainability, and provisions such as a material adverse event clause in case the federal government is unable to meet its promises. However, the Oak Cliff Chamber urges the state legislature and Governor Perry to recognize that insured Texans are healthier Texans and that healthier Texans are necessary for long-term sustained economic growth in our state. We urge Medicaid expansion.
Hello, everybody! Texas Medicaid Matters! Yeah! I am Cathy Cranston, and I'm a community organizer with Personal Attendant Coalition of Texas. Medicaid means jobs. Medicaid is already responsible for creating and sustaining jobs in healthcare and home and community-based services and support programs. There are over 250,000 personal attendants and direct care workers that work in our great state of Texas. And I am one of them, and there are many of you out there today. I have worked as a community personal attendant for over 30 years. We are the backbone of Texas's long-term services and support system. We assist people with disabilities and older Texans to live independently in the community. We are extensions of the people that we assist. Unfortunately, the two things that have stayed consistent within our jobs are that the wages are extremely low and there are no benefits, no health care for us. This is a travesty. According to the Bureau of Labor Statistics, Texas rank is the third lowest wage among personal attendants in the U.S. We need Texas. That's right. Boo is right. We need Texas to invest in us. We are an integral part of the Texas economy. We save Texas millions of dollars in secondary medical costs by being on the front line. That's right, we do. We need Texas to invest in Medicaid, invest in our wages, and invest in the people we work with in their homes. That's right now. When you go and make visits to the legislators, let them know to fund the dollar wage increase per hour for the Medicaid-funded direct care workers and the community-based attendant programs. I can't hear you. That's right. Why do we want this? Because Texas Medicaid matters. Texas Medicaid matters. Texas Medicaid matters. Texas Medicaid matters.
All right, folks, I'm City Councilmember Mike Martinez, and it is truly an honor to be here today. I want to thank you for this beautiful cap, because let me tell you, if I got a sunburn on this head, it would be a medical emergency. So thank you. Listen, I was proud to be the lead sponsor of an item that the City Council unanimously adopted a few weeks ago, urging the Texas legislature to join in the expansion of Medicaid. And so I'm here to further that resolution, to join you all in asking them to please consider expanding Medicaid so that 1 million more adults and 400,000 children can now have access to health care coverage moving forward. I want to thank the mayor and my fellow council colleagues for supporting the item. It was adopted unanimously. But other cities and other county governments and other chambers of commerce are joining in because they realize this is an important issue. It's not a red or blue issue. It's not, an issue that you can really put into a political arena. It's a people issue. It's a practical issue. It's about providing health care coverage to those who sorely need it. I'm in my 20th year of public service. The first 13 was spent as a firefighter. And let me tell you, I know exactly what it's like to take care of folks who don't have health care coverage. They wait until the last minute, until an acute emergency care situation, and they call 911 because that's their last chance. We need to provide preventative care for these individuals. We need to get them into the medical facilities so that it doesn't cost us the amount that it would in an emergency situation. So I've taken that public service to the City Council now. It's an honor to be here with you all. I'll say this to you though. There are some great leaders in this building that are our allies. It is up to us to join with those allies. If certain members want to renegotiate with the federal government on little intricacies about how we expand Medicaid, let's join in that conversation with them. Let's ask them, how can we help you get to our side of the equation and support expansion of Medicaid? There will be some folks that come across. They see the benefit to this. We must go in there today, work with them, join with them, and then help them get fully across to our side so that millions more in Texas can join in having health care coverage. So thank you all so much for being here today. Welcome to Austin to all the visitors. Medicaid matters in Texas.